Hello, welcome back to my channel, English for Nursing Communication 2. This is Ruffel Manalo from the Faculty of Nursing, Nakhon, Pathom, Rajabhat University. So we are now in part 2 of Unit 1, Concept of Academic Reading in Nursing. So let's go to the third strategy about reading. So this is about contextual meaning. So when you read, you do not need to look up the meanings of all new words in a dictionary. Okay, another tip, you can guess the meanings of new words from the context, the other words in the sentence and the other sentences in the paragraph. Using context means to figure out what words mean by how they are used in the sentence or paragraph where they appear. So let's say, for example, this one, contextual meaning. So as you can see, there is the word that is being written in bold letters. The field of nursing has evolved over the years. At present, there are many nursing specializations to address specific conditions. So what do you think is the meaning of this word? You can guess if you don't know. But as you can see in the sentence, it's very easy that it's what? It talks about the development. Okay? It talks about the development. So that is contextual meaning. So the fourth one is about clue. Okay. So in reading strategies about clues, there are two types. We have the definition clue and we have the example clues. So first we will discuss in details about the definition clue. So the definition clue, this helps the reader to understand technical word or words by giving a definition or meaning of the word in the text. So there are words and symbols that introduces a definition. So let's say signal words which are is, are, or, means, is defined as. And symbols like you can see in a sentence, you can see a parenthesis, comma, or a dash. So let's say, for example, a triage nurse is. Okay, so this is a definition, clue. A triage nurse is a registered nurse who is responsible for assessing patients and determining their level of need for medical assistance. And what about example clue? Okay, so sometimes the text will include a word that readers may not know, so you have to take note of this. The writer may help the reader to understand the word by giving examples of things or ideas that are related to the new word. So let's say you can see the examples of that are often followed by words or phrases like, for example, such as, like, and including. So examples can be in the same sentence as the new word or in another sentence. So let's say, for example, there are many symptoms of high blood pressure, including severe headache, vision problems, chest pain, difficulty breathing, and irregular heartbeat. So these choices that you can see here, these data that you can see, they are examples of symptoms about a high blood pressure. So again, you have to take note of the keywords or signal words like, for example, such as, like, and include. Okay, the fifth strategy is about pronoun reference. So what is pronoun? Pronouns are used to avoid repeating nouns that have already been stated in the passage. Pronouns refer also to nouns and sentences. So in pronoun reference, in details like personal or object pronouns, these refer to people or things. It can be feminine, masculine, or neutral. And it can be singular or plural. Like this: I, me; you, he, she, it; he, him; she, her; it. So it, the word it does not change. We, us; they, them. So let's say, for example, Mr. McCarthy's condition is unstable. He continues to be in the ICU for close observation and monitoring. The casualties in the accident are rushed to the hospital. They suffered wounds and fractures. So in the first sentence, he is not repeated. Mr. McCarthy's, which is the subject, is not repeated in the next sentence. The next paragraph, the casualties is not repeated because another word is used, and this is the word they. So this is to avoid repetition of using the nouns in the next sentence. So what about possessive pronouns? So possessive pronoun shows ownership or possession. So let's say, for example, my, mine; your, yours; his, it does not change; her, hers; its, it does not change; our, ours; their, theirs. So let's say, for example, many physiological changes occur in older adults that affect the response to medications. Many physiological changes occur in older adults. So older adults is the what? Is not repeated because another word is used as what? Noun or pronoun. And another example: an empty stomach facilitates an absorption of an oral medication, thereby enhancing its efficacy. So an oral medication is not repeatedly used because another word is being used, the word is. So third example: a nurse prepares nursing care plans according to the conditions and needs of her patients. So a nurse is not repeatedly mentioned in the entire sentence. So instead, her is the correct word to use. So what about indefinite pronouns? Okay, the next one is about indefinite pronouns. So this refers to quantity of non-specific people or things. Like, for example, another, others, none, each, some, and all. So this is what? Signal words that you can see in a sentence. So like, for example, a variety of nursing interventions are available, each designed to promote the patient's well-being. So as you can see there, indefinite pronoun, a variety of nursing interventions. So the signal word, the clue used there is the word each. Okay, next sentence. The surgeon will discuss the latest techniques in wound management. Okay, some of which have never been used in clinical practice. So, latest techniques. Okay, so indefinite pronouns, right? About wound management. So, the signal word that is being used here, the clue, the word that used here is the word some. So, that's it, indefinite pronouns. Okay, let's go to the next one. Demonstrative pronouns. So let's discuss in details. Demonstrative pronouns include this, that, this, those, which, and whose. So take note of those signal words or keywords. Demonstrative pronouns take the place of the noun phrase. So let's say, for example, exercise and proper diet are necessary for a fast recovery. So it demonstrates there, okay, that exercise and proper diet are necessary for a fast recovery. This must, so this refers to exercise and proper diet. This must be planned according to the patient's need and condition. So it is not used again and again. because the demonstrative pronoun keyword signal word this is being used. Okay, next example. Most drugs, except those applied topically for local effects, must enter the systemic circulation to exert therapeutic effect. So most drugs. So it demonstrates about the drugs, and the keyword there is the word dose. So take note of that. So let's go to the sixth one about the reading strategies in answering not questions. So in answering not questions, take note, you have to first pick out the keywords in the question. Skim the passage, don't read every detail. Instead, skim only the passage to find the correct answer. Ignore the options with similar meanings in the passage. You need to find an option that is not true. Okay, that is not true. So this is the keyword. Not true. Not included. Okay, not mentioned. Okay, in the questions. Then, the option you can find in the passage will be the correct answer. So let's say, for example, this one. Body temperature is measured using a thermometer inserted into the mouth, anus, or placed under the armpit. It can also be measured by a special thermometer inserted into the ear canal. So what do you think of this? So let's answer the not questions here. So which is not a site? Which is not a place? Which is not an area? Okay. Used in taking body temperature. So it was mentioned in the mouth, yes. In the ear, yes. In the armpit, yes. But not in the nose. So you cannot find nose in the details of this reading passage. So therefore, the option that is not found in the passage will be the correct answer. So choice number 4 is the correct answer. So what about making inferences? So making inferences, this can sometimes confuse you in answering a reading passage questions. So what is making inference? So this is like you're guessing, professional guessing, or making conclusion based on the information and clues from the text. So remember, a good reader should read along the lines carefully to find out clues or facts. A reader relates the clues to what he or she already knows, previous knowledge, and experience. So let's say, for example, the patient is a 55-year-old man with hypertension and type 2 diabetes. His father died of a heart attack, and his mother and sister have type 2 diabetes. Take note of the words in the questions, in the options. Okay, what could be inferred about the patient's illness? So remember, what is an inference question? This is a conclusion of the reading passage that you read. So choice 1, it is acquired. Choice 2, it is genetic. Choice 3, it is well controlled. Choice 4, it is common to men. So what you can see there, you have to take note of the options. Acquired means to get something as a result of habit and practice. This is a vocabulary word. Genetic, this is to receive as part of DNA cells from parents. So take note what is the correct answer from this inference question. So by reading alone, it's very easy that the correct answer is what? The correct answer is choice number 1. It is acquired. Okay. So next example. When a patient goes to the hospital for treatment, the first nurse that he will meet will be a specialist called triage nurse. So take note, triage nurse is another detail. It could be a vocabulary word. This nurse will make an initial assessment of his problem. A patient with a life-threatening condition will see the doctor immediately. Now, let's find out. Okay, what could be your answer for this question? Who could probably get to see the doctor first? Choice 1. The patient who goes to the hospital early. The patient who is in line. The patient who knows the doctor. And the fourth choice, the patient who the nurse say. Okay, let's go to example number 2. When a patient goes to the hospital for treatment, the first nurse that he or she will meet will be a specialist called triage nurse. This nurse will make an initial assessment of his problem. A patient with a life-threatening condition will see the doctor immediately. Who could probably get to see the doctor first? Choice 1. The patient who goes to the hospital early. Choice 2. The patient who waits in line. Choice 3. The patient who knows the doctor. Choice 4. The patient who the nurse says will go first. So, what do you think is the correct answer? So, you have to take note. Triage nurse is a vocabulary word. So, therefore, the conclusion, what can you see in the sentence? What can you conclude about in the sentence? This is what? Okay, choice number 4 is the correct answer. The patient who the nurse say will go first. So this nurse is a triage nurse. So that's how you are going to answer an inference question. So to conclude, we can say that reading is the most important core skills that will enhance an individual's academic experience. Therefore, when an individual becomes skilled in reading, they could make studying a lot more fun, easier, as well as it could make someone become good in other language skills such as writing, speaking, and as well as listening. So thank you very much, and I hope you will get something from our discussion in this topic. And if you have any inquiries, you can send me an email, send me a line message, or send me a message through my Facebook Messenger. So have a nice day. Take care.